Spotlight: Signs and Syndromes in Cardiology. The Holiday Heart Syndrome. The holiday heart syndrome is classically defined as the occurrence of sudden-onset cardiac arrhythmias, most commonly atrial fibrillation, triggered by acute excessive alcohol consumption in individuals without previously known structural heart disease. The term is widely used today, but its origin is surprisingly modest. In 1978, Philip Ettinger and colleagues published their observations in the American Heart Journal. Over a 4-year period, they identified 24 patients admitted with atrial arrhythmias, predominantly atrial fibrillation, after episodes of binge drinking. Some patients were admitted repeatedly. In total, 32 arrhythmic episodes were documented, and strikingly 25 episodes occurred Sunday to Tuesday or around the year-end holidays. One memorable case involved a doorman who, after receiving numerous bottles of liquor as Christmas gifts from tenants in his building, presented with atrial fibrillation on January the 1st. Since then, our understanding has evolved. Alcohol can clearly act as a trigger, but in most patients, an underlying atrial substrate is likely present. Acute intake promotes sympathetic activation, shortens atrial refractoriness, increases conduction heterogeneity, and facilitates triggered activity. Chronic exposure, meanwhile, contributes to structural remodeling via hypertension, atrial dilation, fibrosis, and inflammation. In other words, alcohol can both create the substrate and trigger the arrhythmia. Recent data reinforce this concept. Alcohol consumption is associated with increased atrial fibrillation incidence and burden in a dose-dependent fashion. A randomized Australian study demonstrated that abstinence significantly reduced atrial fibrillation recurrence in regular drinkers with paroxysmal or persistent atrial fibrillation. And even after ablation procedures, observational data show that reduction or avoidance of alcohol lowers recurrence rates. Importantly, alcohol-induced atrial fibrillation should not be considered benign. Stroke risk is determined by the CHA2DS2-VAS score, not by the presumed trigger. Oral anticoagulation decisions therefore follow the same principles as in non-alcohol-related atrial fibrillation. Current European Society of Cardiology guidelines give a Class 1 recommendation to limit alcohol consumption to no more than 3 standard drinks per week in patients with atrial fibrillation as part of comprehensive risk factor management. Thus, while the original holiday heart concept emerged from just 24 patients, it anticipated a principle that is now clearly recognized. Alcohol consumption is both a potential trigger and a modifiable disease driver in atrial fibrillation, and addressing it meaningfully improves outcomes.